Surgery is not always the only option. There are different things that we can do. As a surgeon myself, I've seen the ability of what a surgery can do, how it changed life, how it can actually really change the people move and how the movement of the body. I'm Professor Paul Lee, ACL and cartilage surgeon. So why do we always have to have surgery? You may see some surgeons, you may see some doctors to say that you have to have surgery. This is the only way that you fix your knee, you have to have a knee replacement. Or you should have a hip replacement for your hip. Is that always the case? Of course, there are some times that when a joint is damaged beyond repair, we need to think about treating it as a whole body. So at that point, we want to replace the joint. However, there are much more modern techniques that we can have, and nowadays technology have moved on. Other enabling technology such as cells technology, growth factor technologies, and also different injections that we can give it to the body allow our body to regenerate. Surgery is not always the only option. There are different things that we can do. As a surgeon myself, I've seen the ability of what a surgery can do, how it changed life, how it can actually really change the people move and how the movement of the body. But at the same time, I do see the potential complications of surgery. If you've done enough surgery, complication will happen. So therefore, for me, my principle of actually treating my patient is first, regeneration. We must try to regenerate first to save what we got. If it doesn't work, or maybe it's far too late, then we will go ahead and replace. I stand in a slightly different position. As an engineer, I like to think about things logically. As a regenerative doctor, I know and I understand the biology and how we should use injection to treat people. But at the same time, I'm a surgeon. If need be, we need to go ahead and correct things and replace things. There's no one answer to fit everybody. It depends on what you feel and depends on what is suitable for you. Surgery is not always the answer. Perhaps there are other things out there. So traditionally, when we talk about if someone actually needs surgery or not, I think it always depends on what the condition is. And a lot of the time when I see a patient that they came and see me for second or the third opinion because the other surgeon or the other doctors told them they need surgery. And actually, when we look at what is the root cause of the problem, and when we actually look at the scan, when we actually see the images, everything changes. Because a lot of the time, people do not look at the actual scan itself. In medicine, we actually look at a report of a scan. I know it's very important to look at the report, and I know this report is done by a doctor called radiologist. They do reporting and scans all the time. However, the biggest disadvantage by a radiologist looking at the report is that they don't actually see the patient. They cannot correlate what is the clinical symptoms, what the actual problem is before they can match it to the picture. I have the advantage when I see my patients that you will have told me the symptom, I will examine and find out what the problem is. Then I look at the scan so I can correlate what the problem is that you have to the scan to actually make things a lot more logical sense. And a lot of time by linking those two together, you actually don't need to have surgery because the problem is elsewhere, can be treated differently. It is very personal and very specific. Every problem is different. It is not something that we can just say that, well, you just have to have surgery. But let's look at the evidence. Let's look at the scan first before we decide what we need to do. So is regeneration risky when we're waiting? So sometimes it is and sometimes it is not. The key is depends what are we dealing with and how long we are waiting for. For example, if we're dealing with an acute injury like an acute ACL rupture, we need to find the answer. So you need to get your scan first. We know exactly what's going on, then we know what to do. If we don't know what happened, we can't just expect that the body will heal on its own because things are completely coming apart. There's no way that one will just jump back to the other. Regeneration is safe and effective if we understand what we are trying to do. Often it takes 2 to 3 months for regeneration to happen. Think of it in your garden. When you try to grow a patch of grass, how long would it take? It does take a few weeks, it does take a few months, but certainly it doesn't take years. So sometimes things work, sometimes things does not work, but the key is understand and respect the principle of the 3 key sciences: physics, chemistry, and biology. Delay or waiting to see it has natural taking its course to help you. Before you rush off to have your surgery, I would like you to take a pause to have a think, is this logical? The surgery that I'm about to have, is it sensible? Does it actually make sense? Do I actually really understand it? If not, ask the question. I am Professor Paul Lee. Stay young, be strong, live forever. Subscribe to my channel. See you in the next episode.